locate those bony landmarks on the spine, then it would be easier to have your patient lying facing up or facing down instead of sitting. Just I want to show you guys better. So I'm just having her sitting, right? So especially for the cervical spine, like here for the MOCOP or the exam for MSEC consolidation, because of the examiner has to see where your fingers are on it. So that's why you have your patient in a prone position or maybe sitting would be the better. But for the board exam, the person who being a body, they know what you are doing with your fingers. So it's gonna be easier for you to have the patient on a supine position because they have the better relaxed neck muscle, then it's gonna be easier for you to feel, okay? So from the transverse processes, so like it's gonna be easier for you to find more the occipital area, right? And then you can feel like the bottom part of it, like the old edge. And you're gonna slide your finger inferiorly from the midline. So when you find the EUP first and then slide your finger in the midline along toward the neck, so then you can feel it. So in this position, I don't think I would be able to feel the posterior tubercle. Like when your patient are relaxed in a supine position and then have their head relaxed, then I may able to feel better. But here, I cannot feel it. So first bump that you do feel, it's gonna be more like most likely the second spinous process of the cervical spine. So you're gonna slide your finger a little bit high up in between, then that's gonna be where the posterior tubercle of the C1 is. And then you can count down from there to like a second and third, and then the fourth and fifth. Like when the curvature started, then it's gonna be a little bit harder to feel it, especially in a sitting position. So have them relaxed in a even prone position would be a little bit better for you to feel than sitting, right? So if you have the bony landmark that is high up here, then maybe sitting. But when you need to count down up to like 5, then it's better to have them in a prone position. So then it's gonna be easier for you to count. Or like if you have C6 or 5, then it's gonna be easier for you to start from the C7, right? It's gonna be easy to find out from the nodding, ask your patient to flex and extend their neck, then you can kind of feel that this one is the 7, and then it's going to be easier for you to count off from there, right? So depending on the level, you can start from top to bottom or from bottom to up, right? And once you locate the spinous process, then the like an inch apart, it's gonna be the transverse process, right? So when their neck muscle is gonna be relaxed, then you can actually kind of pinch and then feel the transverse process, but it's gonna be harder for the sitting position. But where their muscle, like erector spinae muscle, is sitting in like transverse muscle, it's gonna be the lamina in between, and then the transverse process you can kind of find from the side of their neck and then pinching in. So the first transverse process of the C1 is gonna be easier to locate when you go to the actually like side of their head, like there's a mastoid process, and then there is an angle of the mandible, and then you can kind of pinching in that space, then you can kind of feel the transverse process of the C1, and then the rest, it has the sharp in, it's way shorter than the first one, so it's gonna be harder to feel. But like when they are like, oh sorry, almost chopped there. When they relax, that you can kind of pinch in to actually feel the things. So it is gonna be harder for you to count down finding transverse process and counting down, you're gonna lose this. So it's better to find their spinous process and then just to move away and then deepen your finger to find the transverse process, okay? And in between, it's gonna be the lamina. And the articular pillar is before you reach to the transverse process of that level. So articular pillar is the structure of the superior facet, inferior facet meet together, and then because of the height of the cervical spine is really short, it's kind of bump into each other, so it looks like a pillar now. But can you feel it? Not really, because there are a lot of muscle and structure is on the top of it. So you kind of assuming that because it's a spinous process, like on the interior part, it's gonna be the transverse process. And right before that, like the edge of the erector spinae muscle group, it's gonna be the where you can kind of find the articular pillar. But like when you have your patient in a supine position and they are relaxed, then the end feel is a bit different. When you are on the transverse process of the cervical spine, then you can actually grab and then feel it. And then lamina itself is really soft because of all the muscles sits on it. And the edge of all the muscle, you can feel more the firm end feel now, because you can feel it's more bony end feel at the end. That's gonna be the articular pillar.